So yeah, when I sit up like this on my right leg, when my right leg was up, I felt some pain back here.
Okay. On your right side in the glute area. Okay, cool. The last movement I want you to do is a rotation. So just standing how you are with like your hands on your hips and just rotating and moving your chest from side to side in that rotation. Try to keep it just at your hips.
Um, just at my hips or my body,
Like
like
just like
this,
try to keep
or
your
like
rotation just
this.
in like your torso spine area.
Okay,
How's that standing?
standing. It's all right. When I go this way, to my left, it kind of hurts back here.
On your right. Okay.
Yeah, and the more and more we move around and do those, I'm starting to get some numbness in like the back of my knee, kind of like down my, just getting some numbness down there. It's not bad, but just since we started doing those movements, it started to feel numb a little bit
Okay,
or tingly.
what about standing just right straight up how you are right now? Do you have numbness and tingling right now?
Um, no, not
Okay.
right now. It's mostly just when I move.
Okay. Now I'm gonna have you sit down in your chair where you were, and you're gonna do the same thing of rotating, but now you're just in a seated position.
No, that didn't hurt.
Okay, cool. All right, so now that you're seated, I'm gonna have you do a special test. Now, I don't know if you can move your camera down a little bit so I can see, or if not, that's totally fine, and you'll just do it yourself and tell me how it's going. So you're gonna be
Okay.
seated. Make sure that your hips are like at 90 degrees or like, bent as if you were in a chair, feet flat on the ground. And
Uh huh.
you're gonna grip underneath the chair and straighten your right leg. Well, we'll start with your left. We'll straighten your left leg. Right leg is still down on the like foot is touching the ground.
Okay. This feels naughty or something. I don't know what's happening. All right. I feel like we'll see. So put my hands under my butt.
Sure. Yep.
All right, and let's lift my left leg up.
Mm-hmm.
Okay, I don't know if you know I've seen anything, but
Then you go to the side, yeah.
that.
Uh-huh. Straight up. Do you feel anything? Just a regular stretch?
Yeah, it just feels like a normal stretch to me.
Okay. And now let's do the same thing but for your right leg.
That still feels like a normal stretch.
Okay.
Um, yeah.
Okay, and now I want you to do that same thing, but then you're gonna have your right leg's gonna be straight up and you're gonna like hunch forward, round your back, round your shoulders, and bring your chest towards your knees if you can.
I mean, it's definitely an increased stretch, and it feels tight, but it's not the same type of like I feel that all the way down my leg, and it's not like a numbness or tingling, but I feel that tightness all the way from my back, all the way down to like my calf muscle. But it's not the same type tight. It feels more like a muscle tight, not a nerve, like not a numbness or tingling.
Okay. And your numbness and tingling doesn't pop up when you do that.
No.
Okay. One of the last ones that I want you to do is you're gonna stay seated where you are and you're going to bear down. Don't pretend like you're going to the restroom.
Okay.
Any symptoms that pop up with that?
No.
No. Okay.
No issues. No.
Cool. So then the next one I want you to do is stand up for me. You can keep the camera where it's right now because I just want to look at your hips. And you're going to, I don't know how to, You're gonna pop your hip out to the side like you're like show like your glute. Yep, and bending your hips. So here, I'll try to. Like this. You should feel a stretch right in your hip.
Okay, like that?
Yes.
Okay. I mean, I kind of feel something like, hold on, let me show my butt to you. I kind of feel something like here.
Uh-huh.
Like, so if this is like my tailbone, and this is my leg bone, I kind of feel something here when I do that.
Okay. And does that feel like a stretch? Does that feel like you're getting numbness and tingling again?
It definitely feels tight, but you know, like when I do it, I do gotta get that, not necessarily like a lightning bolt thing, but you know how sometimes like when your leg's asleep,
Yes.
kind of feel like, but now it's not there anymore. But when I do, like when I sit like this, I feel that tightness there, and then I kind of feel like right now I'm starting to feel some like tingling down the back of my leg a little bit.
Okay. Okay, that gives me a good idea of what's going on.
Okay.
So unfortunately, since I'm not there, I can't do like everything that I would like to do. But I think that I've got a good idea of I think of what's going on. Definitely some differentials, possibilities of what could be going on. But with all of this, my question is like, what are you out of all this? Like, what's your goals eventually to do like for this injury?
I really would like to get back to being able to train. I mean, that's my biggest thing. I mean, I can't, you know, I really want to do this, and I can't not train for a marathon. So the big thing is I want to do is I want to get back to running.
Mm-hmm. What's another goal of yours? Maybe it doesn't have to be related to marathon, but I mean, if there's any other goals you may have.
What was that?
What other goals besides marathon training?
You know, I'd like to be able to sit and make it through a work day without having my pain.
Understandable. That would be nice. For I guess for your work, because I'm trying to get some goals going here for you. So I know returning to a marathon, your marathon is in 4 months, so that's still you're still within like that training time that you can get back and still have an appropriate training. And then sitting and working makes sense as well for your daily activities of what you're doing every day. And we can really get that going pretty quick. So my next, I guess, what I think is going on can kind of go with a couple of things. Like, so my initial what I think is happening with you is that you probably have some, it sounds like there's definitely a neurological issue going on with that numbness and tingling that you're getting. And it's going down, it's not going past your knee, but it is starting in that glute area and going all the way down. I couldn't do all the special tests I would like to do, but I think with what I've heard from you and just from those little movements that I had you do, it's sounding to me like there is some nerve entrapment possibly in your piriformis, that sciatic nerve. It's a giant nerve that starts right in that hip area, and it sounds like it's either getting pinched, there's a muscle that could possibly be pushing against it, and it's giving you that or if you have an inflamed and like muscle or something along those lines, and that could be pinching and pressing up against your sciatic nerve, giving you all those neurological symptoms of numbness and tingling. Um, because I had you do some things and for like a herniated disc or for that nerve, and I feel like I'm getting more, not so much of a herniated disc. It's what it's sounding like to me. It's sounding more of a muscle inflammation pushing up against that nerve. So what I would like for you to do is, I mean, I can give you some stretches and exercise. I mean, like you said, you did stretches and exercise and that helped, and then you stopped. So if you can return back to doing those stretching and rest when you can, make sure you get a good recovery time between your workouts, but get back into stretching, get back into doing those every day to try to loosen up those muscles. And then also too, if you could, like if you want to continue to seek further help too, going to your local, I can see if we can get you into a local PT clinic or seeing a local athletic trainer if I have some connections where you are at, and see if they can maybe give you some further, maybe like a manual therapy, see if they can get some hands on you and try to help you out there too as well. And so that way we can reach your goals of returning to your marathon and being able to complete that in 4 months, which I think is completely doable if we, get back into stretching and do and see if that will help and continue to do that. And then also with that same thing is being able to have you sit and work. I know being in a secretary position or administrative position, you are seated a lot. So if we can try to, make your work day a little bit easier so that you can be productive in the workplace. Do you have any questions for me?
No, you just said you were going to send me some exercises. Is that what you said? You're going to send them to me via email?
Yes, I will email those to you. I have a whole program of stretches, and then also, would be great too. And I am totally in love with this and love telling my patients this is yoga. Some stretching yoga that will really help too. I can send you some yoga videos. I have a whole folder of them that would really help you. And so that would really focus on core strength and stretching your legs and all those structures surrounding those nerves, and hopefully give you some relief.
Okay, that would be great.
Okay, awesome. Well, I will email you shortly with those videos and that index of the patient-related outcome, and I will talk to you soon.
All right, great. Well, thank you very much, Shannon. I appreciate you taking out the time
No
of your day
problem.
to help
No
me.
problem. All right, have a great day.